Channel 3.
You know, 10 months is a long time, and that's how long we've all been dealing with COVID-19. We have had our focus, understandably, on how to stay safe with the COVID concerns, but the truth is, in the course of 2020, there may have been a lot of other health concerns that didn't get addressed. Doctors have been warning of us of this fear that they've had. This morning, Dr. Takleyla Williams, who is a surgical oncologist at the Mary Ellen Locher Breast Center, joins us because sadly, Dr. Williams, you're sort of seeing the effects of this change in our habits in 2020. Good to see you this morning.
Good to see you this morning.
So this was a concern that I think you yourself expressed with us over the course of 2020, that an ounce of prevention is worth that pound of cure, and you were concerned that women were not going to get their mammograms in 2020. That's kind of what's happened in some cases.
Definitely, that's what we've seen over the last several weeks. We've noticed that, during this pandemic, many women are afraid to come out and get their annual screening mammograms. And even some people that have issues with the breast, they're still afraid to come out and get diagnostic imaging. And so what we've noticed is that over the last several weeks, we've noticed that a lot of women who have come in, now they have more advanced stage cancers because of the pandemic and not seeking treatment earlier.
Okay, so talk to me a little bit. I know that the importance is to get those mammograms. Is it yearly once you are 40?
So yes, we recommend annual mammograms starting at the age of 40 until your lifespan is expected to be less than 10 years. Okay,
so maybe what happens is in a woman's mind, she was scheduled to get her mammogram in April, and she thinks, you know what, this is of 2020, and she thinks I'm not going to go, I'll just wait, and I'll go next April. What difference could a year make? If you have a cancer there, do they tend to grow rapidly, or does it depend on the type of of the cancer that you have?
So it definitely depends on the type of breast cancer. Some cancers are slow growing. However, we never know who that's going to be in. And a year can make a huge difference in someone seeking treatment. And that could mean us finding, as the surgeon finding an early stage breast cancer versus a later stage breast cancer. And essentially what that equates to is the earlier we find things, usually the less treatment on the back end that you have to receive, versus if we find cancers at a later stage, then usually those people have to end up taking more treatments on the back end after surgery.
One of the things that you're so known for there at Mary Ellen Locher is the mobile mammography unit that you have. Have y'all been utilizing that during COVID?
Yes, we still have been utilizing our mobile coach. Initially it wasn't as much as what we were previous, but definitely we're still utilizing our mobile coach, trying to reach those communities and make it more accessible to get their screening imaging every year.
So are you expecting that maybe you're going to have an onslaught of patients trying to make an appointment? Because obviously we're still living with this virus and life does have to get on. What are you advising people to do in terms of making an appointment?
So definitely do not defer your screening imaging. At Mary Ellen Locher, we're doing our part, and so we just ask that you do your part and definitely schedule those screenings. Schedule, if you have an issue, let us know so that we can get an appointment. And like I said, we're doing our part. We're wearing our masks, we're sanitizing our equipment and our areas appropriately. You
said if you're having an issue, sometimes you don't know that there is something going on, but is finding that lump still the main way women realize they may have a problem, or are there physical symptoms that you can sometimes feel?
So definitely there are physical symptoms, such as feeling a lump, having changes in the skin, or the nipple area, such as pulling the nipple in, what we call inversion of the nipple, or if you could have dimpling of the skin. So those are other signs and symptoms that people may have that may clue them in that they're having an issue with the breast. But by far our biggest way of determining issues with the breast is definitely our screening mammograms.
I know that you don't ever enjoy having to come into a patient's room and tell them that the mammogram came back with a concerning image. But you have a lot of comfort as an oncologist in being able to give them hope, especially when it's caught early.
Definitely. We've made so many advances in our imaging and our treatment in regards to breast cancer that, like you said, I hate to give and be the bearer of bad news, but I also get to tell most of my patients that this is something that, we're going to have to do treatment for, but you're going to live and you're going to be fine.
And is it a false idea that women have that if they are a little bit smaller chested, they're not as likely to develop a breast cancer as if they have a bigger chest?
Definitely. That is definitely a myth. The size of the breast has nothing to do with the development of breast cancer.
Well, you are very good to meet with us this morning. If people are wanting to make an appointment, do you have just the one location or multiple locations where they can come and see your group?
We have multiple locations. So we're, of course, downtown at our Glenwood location. We have a satellite location in Hickson, in Ringo, off of the Parkway, as well as Ottawa.
Well, it's great to see you. Thank you for the reminder. Keeping on top of your medical situation is so very, very important. The numbers there on your screen to reach both the Memorial Breast Care Associates as well as Mary Ellen Locher. We are back after this.
Attention homeowners, we started with 50, now we're looking for 30 homeowners to participate in our home evaluation program. Homeowners are concerned about safety.